In this section, we're going to talk about the epidemiology of C. difficile infection. And it should come as no surprise to anybody who clicked on this video that the Centers for Disease Control and Prevention issued a threat level of urgent for C. difficile in 2013. This was based upon data from 1999 through 2010 that showed a remarkable rise in the incidence of C. difficile, as well as a huge financial burden on the United States healthcare system. The landmark study currently that looks at the epidemiology of C. difficile infection in the United States was put forward by Lessa et al. In 2015 in the New England Journal of Medicine. Lessa looked at the Centers for Disease Control and Prevention's Emerging Infections Program, a program that looks at 10 counties throughout the United States and projects the trends from those 10 counties on a national scale. Overall, looking at 2011 as a year, 453,000 patients were estimated to get C. difficile in the United States alone. Of those patients, it was estimated that approximately 2/3 had healthcare-associated infection, whereas 1/3 had community-associated infection. Community-associated infection being defined by individuals having the onset in the community or within 72 hours of admission to the hospital when they were not hospitalized within the previous 12 weeks. Of that 1/3 with community-associated infection, 18% had no contact with medical care. They didn't visit a doctor's office. They didn't go to the hospital. It's unclear why they got the C. difficile. The healthcare-associated infection accounted for 2/3 of all infections. Of those 2/3, 25% had an onset in the hospital, implying most of these individuals had an exposure in the hospital, but subsequently developed the symptoms outside of the healthcare system. In 2017, Ma et al. Published a manuscript that updated our understanding of the epidemiology of C. difficile. Ma looked at the OptumRx database of 39 million commercially insured lives from 2001 until 2012. And what Ma found was that the incidence of the infection, that increased 42.7%. But the incidence of multiply recurrent C. difficile, that increased 188.8%. So what we see are two important trends. A trend in the increase in the incidence of the infection, but also the refractory nature of this disease.